It is the promise dated 27th of June 2013 in the name of a collective bargaining agreement that owns the country's health sector. In that document signed between the Minister of Health and the doctors' officials, a 300% increment in the basic pay was to be implemented, with the lowest paid doctor set to receive 107,000 from a low of 35,910 shillings. The deal would have pushed a doctor intern total monthly pay to 325,730 shillings from 127,000. But county governments who employ the bulk of public hospitals' doctors have, through governors, disowned the agreement on grounds that it was signed with the national government to their exclusion. The national government has since made several attempts to resolve the stalemate, including President Kenyatta, who on the 4th of January offered the medics a 4 billion deal. The president's offer that the doctors also rejected would have seen the lowest doctor earn between 185,000 and 196,000 shillings. A medical officer of Job Group P would have taken home between 284,000 and 312,000 shillings, but the doctors demanded up to 601,000 for the cadre. The senior-most doctor, according to the government's offer, would have made up to 572,000 against the CBA come doctors' demand of between 852,000 and 946,000 shillings a month. The Kenya National Commission on Human Rights, that had been mediating the CBA standoff alongside the Central Organization of Trade Unions, reporting progress.
Indeed, about 90% of the issues in the agreement were totally settled, actually above 90% of the issues. And we were literally at the tail end of the negotiations and the agreements when time simply lapsed.
During the talks, the government had offered an extra 500 million shillings to the doctors in allowances, an offer the doctors rejected, instead insisting on the 300% raise in basic pay, an increment in allowances.
We gave the mediation team that 10,000 to offer to the doctors, if that is going to solve our problem. We gave that on Friday, hoping that on Saturday we'll get a return to work formula. From the reports we received, they again negated on that.
The Law Society of Kenya is now offering to help with the mediation.
We want to insert ourselves into the process by appearing in court, but we also will continue now to offer the services of our expert mediators.
The mediators are clinging on to what they term as advanced negotiations that would have formed the basis for a return to work formula. However, all that now lies in limbo as the doctors retreat to a backseat to cut their losses and plan for their future. Gituku, Citizen TV, Nairobi.